Hello, Be Smart viewers. Our next conversation of Managers Mantra turns to one of India's fastest evolving sectors, healthcare. Joining us now is Dr. Sujit Paul, Group CEO of Zota Healthcare, to discuss the rise of generic medicines, pharmacy retail, and where the industry is headed next. We also ask what opportunities the changing landscape creates for MBA students and future managers. Take a look. Thank you so much for speaking to Business Standard, Mr. Sujit Paul. My first question to you is, what is the driving force behind the shift towards, generic medicines in India today?
Well, if you see India at large, since 1947, since independence, lots have changed. What have not changed probably is good quality education, good quality healthcare, and certain things related to this. So there is where I think generic medicine plays a very critical role, because the truth is expensive branded medicines cannot be afforded by all Indians, or rather I would say most of the Indians. So I think that's one strong parameter that India really needs to shift. And if you see the players in the country, most of the so-called organized players, be it in offline or online, they have all been focusing on branded medicines, which are very, very expensive and not congenial for the common man's pocket.
Right. But when you talk about generic medicines, the one thing that comes into each and every one of our minds is consumer trust.
Yep.
How do you instill that, when you compare generics to branded medicines?
You know what? When we were all shifting from ATM cards, from the so-called tailor in the bank, there was a trust issue that will the ATM dispensing machine roll out the correct currency notes?
Yeah.
And I can talk on and on and on. When you and me had BSNL telephones in our home, our parents said, no, let us keep the BSNL telephones and still let us have a mobile phone. So we all saw those things, right? I think what's really, really important is for people to understand and get educated that high quality generic medicines are not only affordable, they're very, very good in quality. And it works as good as branded medicines.
Right.
And today, with the open internet, they can also refer back in all advanced countries, be it UK, US, parts of Europe, and so on. Everywhere is generic medicines. And I think open internet have really, really helped people to get educated that it's time that people need to wake up and make the right decision to shift to generics.
Right. Mr. Paul, can you tell me the business model behind, scaling a pharmacy chain like DavaIndia?
I think the core business model lies in working out multiple different structures towards ensuring that you are close to the consumer. When we are doing that, a fundamental DNA of that business model is that we would keep our internal and external employees and customers happy. Now, that's where most companies go wrong. They operate business models only to make money and make profits. We don't do like that. We ensure that the consumers are well taken care of, I mean the patients, in terms of stringency of quality, as well as our internal customers, which are the employees. They are first taken care of. Unfortunately, most organizations in India, be it healthcare or elsewhere, their only and only perspective is how to make money. Of course, yes.
Right.
But the model only sustains if you have an internal model correct.
Okay, right. In today's market, especially in the healthcare retail, what do you think matters more? Do you think it's pricing? Do you think it's trust? Or do you think most importantly, it's accessibility?
I think trust and accessibility is very critical parameter along with pricing. Why so? Because healthcare is a serious business.
Yeah.
So if people don't trust you, they would not. And every trust comes from your home inside. If in your home you are not working trustworthy, then you can't go out and shout to the customer and say that, hey, I'm trustworthy. So as I keep saying, if I don't do the right kind of things
Yeah.
to my people internally, there is where hypocrite companies comes out, where they go out and talk all big things. They do a lot of activities, but internally there is no trust. So where do you build up? Nothing. It's a hollow box that gets built.
Where do you think you are at that stage with DavaIndia when it comes to the trust factor?
I think by the grace of God, we have very happy employees. We do take care of our people very well. We are very culturally rich employees, employee-friendly organization. From a consumer perspective, we ensure very stringent qualities
Hmm.
at all levels, sourcing
Hmm.
from the highest standards of factories, maintaining a very high standard at a store level, having pharmacists in all the store. I think internally and externally, we are very poised to ensure that we have a tight, robust structure in terms of the entire ecosystem is concerned.
Right. Mr. Paul, could you give us some management lessons, of building an entire nationwide healthcare network? What are the top five most important factors?
Most important, genuinely take care of your people first. Whichever organization you are working for, if that organization do not genuinely take care of you and go out and talk big things, go out and do great supply chain management, go out and do great storylines to build profits, build
Yeah.
turnover, it doesn't work. If you do not know how to take care of your own people genuinely, the word genuinely is important, then you don't get into the right management jargon to build an organization and thereby a country by itself. It all comes from your inner self. I'll give you some examples. How many organizations in India does genuine sense of training and development for your external and internal people?
Hmm.
They do once, twice, thrice a year, 4 times a year. For our core people, core team, last year itself, we did 176 training programs. Tell me which organization in India does that? Training is time and cost. We believe that moment people get trained well, then they're sharp enough to execute. I'll
Absolutely.
give I, the other management lesson says don't only strive to build profit. Profits is very important. Without profit, it cannot happen. Without scalability, it doesn't happen. Without
Hmm.
top line, it doesn't happen.
Yes.
But if you're not a human, it doesn't work. For example, we have something called hashtag animals where we take care of the street animals, where there's a whole campaign that runs across the country to
Yes.
ensure that dogs and the cats and the birds are all well taken care of, whoever is sick.
Yes.
We have lots of such programs running in the organization. We have a strong women battalion force that work for us. We have a program where the core team is externally trained out of the office environment
Hmm.
once every 100 days. They have to go out somewhere and they have to get trained. So there are lots of programs. So a good management lesson works when you first get your house strong, and then comes towards ensuring that you build your consumers. Unfortunately, most organization in India does the reverse. They
Hmm.
try to go
Correct.
out, try to scale up, try to build customers, try to get top lines when their inner organization is toxic, when their inner people are all suffocating. They are not willing to come to office on Mondays.
Yes.
That's hypocrisy. And that is a wrong management perspective that flows through. If someone really wants to build, irrespective of healthcare or anything else, and understand the management philosophy towards building the ecosystem,
Yeah.
they have to first strengthen the base of the fort inside and then take it forward.
Lovely, lovely. Thank you. Thank you so much for that. We did hear about the management lessons, but when it comes to the healthcare sector, especially for MBA students, keeping that in mind, entering healthcare, how important do you think these management lessons are, along with domain knowledge? Domain knowledge
We
versus management skills. What's more, what takes the.
most important is management skills, followed by domain knowledge, unless you are a physician or a surgeon. See, I'm not a pharmacist.
Hmm.
I'm not a registered pharmacist,
Yeah,
but I manage and I have been managing multiple other healthcare sectors earlier.
yeah.
The largest hospital in India been managed by four daughters who are not practitioner physicians. So it is a management lesson that really, really works well. For healthcare professionals, it's very, very important. that they're compassionate,
Hmm.
they understand patient care. For example, if someone walks from the pharmacy having fever and they don't have money, you can't go and tell them, plus first give me money and then I'll dispense.
Yeah, absolutely.
So management lesson comes first. Of course, technical knowledge is important,
Yeah.
but first is management lessons.
What about challenges, Mr. Paul? What do you think are the biggest challenges for management graduates, when they're leading doctors, pharmacists, or, all kinds of medical teams?
Be it physicians, nursing, pharmacists, phlebos,
Hmm.
I think for the young professionals, it's very important for them to be patient to go. Unfortunately, in today's world, whenever I go to teach in the colleges or universities, I find that young students who comes up in the world of management, they are impatient. They want to grow much faster. Now that's a scare. You have to learn the business. You
Right.
have to be patient enough. You
Yes.
have to grow. You have to give time. Keep in mind, great food takes time to get cooked.
What are the best career opportunities for MBA students in today's day and age in the healthcare and pharma sector?
Uh, I think lots. They can get into hospital administration. They can get into medical tourism. They can
Hmm.
get into as an entrepreneur and build great pharmacy chains. They can get into biomedical. They can get into there are. I think I can talk about hundreds, but it's not about that.
Yeah.
It's about, are you really, really ready for that? Are
Yeah.
you really compassionate? Are you really, do you have the feeling that patient first? Now, once the young MBA grads understand that compassion, emotion, these are also attributes of a professional growth, then wonders happens. That's what I said. Unfortunately, in today's world, that's almost getting vanished. And that's where organizations are also very shallow.
And they're suffering, right? It's interesting that you brought up medical tourism. India is emerging as a medical tourism hub.
Yeah,
What opportunities do you think this creates for, health businesses and for all of future managers?
a lot. See, if I still believe that we have not really touched medical tourism yet. See, whatever medical tourism that you really see in India is not the truest sense of medical tourism. What happens? You see that, patients come from Africa or Bangladesh or from other countries and they get treated in some hospitals. That's not what is medical tourism.
Mm,
Medical tourism is a truest sense when you can imbibe
mm,
patients along with travel, along with the greatness of India that we have in a truest business sense. Unfortunately, many hospitals do not have the right ethical business sense,
mm,
but they name it as medical tourism.
mm,
That's not what it is.
mm.
You have to operate on the ethics part when you operate on any of the business, including medical tourism.
Okay. Okay, let's talk about today's day and age and the buzzword AI. How do you think AI is changing the healthcare operations, pharmacy, retail, and of course, patient experience overall?
AI with blockchain, the data analytics is changing the world at large. I strongly foresee that there's lots more to come. But what as an experience it's changing is that we can do predictive analysis. We understand the kind of forecasting medicine management that happens. Pharmacy dispensing can happen through robotic management.
Hmm.
Surgeries are happening through robotic managements. But I think that's again just a start. The way I see is that eventually you will not really need a degree doctor. Everything will be artificial. You know why? See, today you and me, if we are not even having a degree, we can still get the information and data
Correct.
through OpenAI or through ChatGPT and more. So you don't need anymore a degree unless you have to get in a specialized part towards getting into a structure. So I foresee that be it pharmacy, be it surgery, be it phlebotomy, everything will gradually get replaced with AI tools, and robotic management. And everything will be program based.
And you think that's
And when
safe?
it's that's coming very fast. And that is what would rule ahead for us. Means, why do you need someone, think well, why do you need someone to study so hard for 5.5 years to become a doctor, and then after that to become an MD? For what?
Yeah.
You go and you get all the data, including the theory and the practical, and then you merge it with the robotic management. Take my words, that days are not very far off.
Right.
And when you come, when you actually amalgam it with a lot of data understanding, then what happens is that you can get a surgery done.
Mm.
So whatever hard work that. Okay, let me give you an example. When people may say that, okay, it may not be appropriate. How many phone numbers do you remember? You don't.
You know.
You go to your phone book. We use calculators to calculate, right? So that day is not far off when all data will be there in the internet. You just need to know how to access it, and there will be the robotic management that would govern to take care of everything. Trust me, that day is not far off.
Lovely. Thank you. Thank you so much for that. My final question to you is, Mr. Paul, how do you believe healthcare could be, one of the game changers and the most rewarding sectors in the next decade? And this is a question pertaining to particularly MBA students. Why do you think they should pick healthcare as their domain?
If I talk based on India, it's a large country with huge demographical differences. Healthcare is the only thing that would be sustainable.
Mm.
And the young students, they have seen when COVID was there, other businesses were all shut. It was only healthcare that sustained.
Yeah.
So they must understand, to build a better India, we have to get into those healthcare sustenance models. We have to ensure that the country at large, including the villages, get proper access of basic medications, of basic tertiary and primary hospitals, of the basic healthcare management. That's a tall task that India has. And I really urge the young students who comes out, they get into healthcare as a profession,
Yeah.
so that we can build a better Bharat for all of us.
Absolutely. Absolutely. Thank you. Thank you so much, Mr. Sujit Paul. We appreciate your time and all the efforts. Thank you. Thank you so much.